This section is covering Chapter 13 for the final exam review. Now we're going to start talking about preparing for pregnancy and during pregnancy. So if the mother goes into a pregnancy underweight, then it's a greater likelihood that the infant is going to be underweight. If the infant is underweight, then it's a predictor of poor future health. So if an underweight infant is the most potent indicator of an infant's future health. You'll definitely see that on the exam. Now, if the mother is overweight, the infant is generally overweight, and that's going to increase the risk of neural tube defects. Now, as far as the mother being overweight for her own health, the mother has a greater risk of hypertension, diabetes, drug-induced labor, and C-section. Now, the reason the infant birth weight is the greatest, most potent indicator of the future health is when we look at the low birth weight, it's associated with a lower IQ, shorter stature, and 40 times more likely to die within the first year. 40 times. For infants that have a higher birth weight, then there's certainly a larger size, and they're also twice as likely to have neural tube defects. And as we talked about in the last lecture, they also have a greater chance of obesity, which then sets them up for metabolic syndrome and diabetes. As far as the nutrients during pregnancy, there are just a few that I want you to know that are important, and we've already talked about folate. But look at this chart. You can see that for a non-pregnant woman, this is the RDA for folate. During pregnancy, it actually increases. So the need for folate during pregnancy increases. And then while they're breastfeeding, the need is increased, but not as much as pregnancy. So supplementation is generally recommended during pregnancy. Why is this? We've already talked about this, but the increased risk of neural tube defects with low folate, specifically spina bifida. So folate deficiency leads to abnormal spinal cord development, which is a neural tube defect. Now, calcium. Actually, the need for calcium actually increases, but the amount of calcium recommended does not increase. So look at this. During non-pregnancy, here, pregnancy and lactation, breastfeeding, the recommendation is the same, even though the need increases. Now, how is that so? Well, calcium absorption doubles during pregnancy. So the recommendation doesn't increase because the body naturally adapts to pulling more calcium essentially out of the food and into the bloodstream. What about iron? Here's the iron recommendations during for non-pregnancy, but does shoot way up during pregnancy. But look at this, it goes way down during breastfeeding. Now, iron supplementation is recommended during pregnancy, and we talked about this before too. The fetus needs that store for the first 3 to 6 months of life, and so that's why the fetus is basically drawing on all this iron, so it has this store. But once the baby is born, then they already have that store, so they don't necessarily need as much. So actually, that's why the recommendation goes down. So iron supplementation actually is recommended during pregnancy, along with folate supplementation. You don't need to know all the features of fetal alcohol syndrome, but what I do want you to know is that this is the most common cause of preventable mental retardation in the world. So we're going to talk about breastfeeding now and why breast milk is the best food for a newborn, and essentially gives all of the macronutrients or carbohydrates, lipids, and protein in the exact quantities that the newborn needs. So the carbohydrate form is lactose, very easily to digest, enhances calcium absorptions. The main source of energy is lipids, and it has ample amounts of essential fatty acids. The proteins are easily digested. Vitamins and minerals, high in all of them with the exception of vitamin D. Generally, we evolutionary-wise, expected to get all the vitamin D from the sun. Now, a sunscreen, infants are not getting enough vitamin D and keeping covered up, so vitamin D actually is supplemented during the early years. Otherwise, breast milk is the perfect amount of calcium, zinc, iron, and low in sodium. What you cannot get from any sort of infant food feeding supplements are these immune factors. So the antiviral agents, antibacterial agents. Infants who are breastfed have less GI disorders. So in the very early stages of the breast milk, those first few days, there are antibodies. So all of these immune factors are passed on to the infant, giving them a better immune system. So breastfed babies are less prone to develop stomach and intestinal disorders during the first few months of life. Now, what about those cravings during pregnancy? Are they, if a pregnant woman is craving pickles and ice cream, is that salt need, meaning that they need more sodium? Actually not. It's not really a physiologic need. There's never been any research to support this. Instead, researchers generally think this is hormone-induced. It changes the way that you smell things and you taste things. So that turns into the cravings. So it's not really a need for that nutrient, say a fat in ice cream or a salt in pickles. I'm going to finish up with just a couple topics of some research that I covered. Now, I remember in this one study back in December of 2014, researchers found that mothers who were pregnant women who were eating diets high in refined carbohydrates like breads and essentially more of a processed food, junk food diet, did have an increased blood sugar even without having diabetes. And what this led to was larger babies. Now remember, larger babies are associated with an increased chance of neural tube defects, but this also meant that the babies were essentially born with higher insulin levels and higher blood sugar. So what does that mean? It's basically setting up this baby for an increased chance of obesity and diabetes later in life. Almost like the baby is being born with pre-diabetes, which is pretty scary. That means that what the mother eats during pregnancy is really a big predictor of the infant's health down the road. And this was shown somewhat also in rats. This is a very fat rat in this experiment. And it looked at basically a maternal junk food diet in rats and found that essentially eating all that processed food increased the amount of sugar, fat, and salt in the diet. So these babies were being born almost with a food addiction, meaning that their reward system was desensitized. Just like a heroin addict needs more and more heroin, these babies were being born with a greater need for sugar, fat, and salt. So again, they had more food addiction, setting themselves up for food addiction later in life. Also, everything that goes along with that, obesity, diabetes, metabolic syndrome, chronic disease. And this will be the end of this section on Chapter 14.